charming. Pet guru. Why your dog wetting bed but not urine? In 2024. When I bring a new puppy or dog home, there are lots of things I'll want to do to take care of them. One important thing is teaching them how to behave, and potty training is a big part of that. Most people start with housebreaking and teaching their dogs where and when to go to the bathroom. The best time to do this is when my puppy is between 12 and 16 weeks old because by then they have more control over their bladder and bowels. Once my pup grows up and learns to go to the bathroom in the right place at the right time, it can be alarming to find wet spots where they shouldn't be, like on their bedding. I might worry that my training didn't work, but sometimes there's a different explanation. It might not even smell like urine, which could mean my dog is dealing with urinary incontinence issues. But there could be other reasons too. Keep reading to learn more. My dog's bed is wet, but it's not pee. Why might that be? If I feel that the wet patches on my dog's bed aren't urine, it's fine. I shouldn't worry. Lots of other reasons can also make their beds seem wet. They could either be non-medical reasons or even medical issues. Let's discuss each one of them in detail. Medical reasons. Now, let's talk about the more serious stuff. My dog could be dealing with a medical issue causing his bed to be wet. The wetness might be because of fluid buildup or even urine. But I shouldn't freak out when I hear urine. My dog might not be wetting his bed because he didn't learn well. He might not even realize it's happening due to some underlying issue causing him to pee involuntarily. Let's go over the possible reasons one by one. Understanding other potential medical issues such as experiencing pain randomly can also provide insight into their behavior. Reasons number 1: ruptured cysts. My dog could have had a cyst under his fur that got big and burst while he was asleep, causing fluid to leak onto the bed. If I notice his bed wet when he wakes up and sees him licking at something seriously, it could be the ruptured cyst. If I don't act, it could lead to complications like inflammation and infection. Reasons number 2: bladder hypermobility. When the bladder muscle contracts too much, urine might leak out involuntarily during the day or at night. If it happens at bedtime, I might notice wet spots on his bed the next morning. In this case, urine is causing the wet spot, but my dog isn't doing it consciously. It might be a neurological disorder causing urinary incontinence. Reasons number 3: bladder tumor. If my dog has an abnormal growth in his bladder like a tumor, it could reduce the bladder's ability to hold urine, forcing it to leak out. Not just at night but during the day too. Other signs of a bladder tumor may include bloody or discolored urine. Reasons number 4: ectopic ureters. The ureters normally pass urine from the kidneys to the bladder, but in ectopic ureters, they don't attach directly to the bladder, causing urine to leak outside. This condition is more common in females and may be present at birth or diagnosed later. Reasons number 5: urinary tract infection, UTI. Bacteria in my dog's urinary tract can cause a UTI and sudden urinary incontinence. He might also show other symptoms like discomfort during urination and licking his genitals. Reasons number 6: Cushing's syndrome. If my dog is producing too much cortisol hormone, it could lead to urinary incontinence along with other symptoms like increased thirst, appetite, excessive panting, and hair loss. Reasons number 7: urinary incontinence. This can result from kidney and bladder problems or be a condition on its own. For example, spayed female dogs or elderly dogs might develop urinary incontinence due to weakening bladder muscles over time. These medical conditions need attention from a vet for proper diagnosis and treatment. Non-medical reasons. Non-medical reasons are usually about behavior. For example, if my dog is bored and starts licking or drooling, it could wet the bed. Sometimes, it's just because of the temperature outside, and my dog sweats a lot. There are many reasons for this. Reasons number 1: excessive drooling. My dog may drool for various reasons. It could be a tooth problem, a mouth tumor, or gum irritation. But sometimes, it's just because they're dreaming about food or other things. Whatever the reason, it might lead to those wet patches on my dog's bed that don't smell like pee. Reasons number 2: feeling warm. Dogs can't cool down as quickly as humans. So, if it's hot outside and my dog's bed is in the sunlight or the air conditioning is too high, my dog might sweat while sleeping, making the bed wet. Reasons number 3: licking and biting. My dog might lick its paws or bite things a lot, maybe because of a change in routine or feeling bored. It could also be a sign of separation anxiety or if my dog has an injury. Whatever the reason, excessive licking and biting can make the bed wet. Reasons number 4: wet dreams. It may sound strange, but some dogs have wet dreams like humans. Even though not all vets agree, some dog owners have seen it happen. It usually involves males ejaculating involuntarily during an erotic dream. This can also happen in young females. So, if I have an unsprayed female or an unneutered male dog, that whitish patch on their bed might not be urine. Identifying the reasons behind my dog's wet bed. Identifying the reasons behind my dog's wet bed involves careful observation and sometimes consulting with a veterinarian. This process can be similar to understanding why your dog just stands there and won't move, as it requires attention to their behavior and potential underlying issues. Here's how I can go about identifying the causes. Observe my dog's behavior. I should watch my dogs closely, especially when they wake up or approach their bed. I need to note any signs of discomfort, such as whining, licking at their genitals, or repeatedly changing positions. These behaviors might suggest urinary discomfort or pain. Check for odor. I can take a sniff to determine if the wetness has an odor. Urine typically has a distinct smell, while other fluids like sweat or saliva might be odorless. If there's a strong urine odor, it could indicate urinary incontinence, a urinary tract infection, or another bladder-related issue. Examine the wetness. I should assess the wet patches on the bed. Are they localized to one area or spread out? Is the wetness consistent or intermittent? A concentrated wet spot might suggest urinary incontinence, while more widespread wetness could be due to excessive sweating or drooling. Consider environmental factors. I need to evaluate the environmental conditions where my dog sleeps. High temperatures or humidity levels can lead to increased sweating, especially if my dog's bed is located in a poorly ventilated area. Similarly, if my dog tends to drool excessively, particularly when bored or anxious, this could also contribute to a wet bed. Monitor for other symptoms. I should look for additional signs that may accompany the wet bed. These could include changes in appetite, drinking habits, energy levels, or unusual behavior. For example, if my dog is drinking more water than usual and experiencing weight loss, it might indicate a medical issue like diabetes or kidney disease. Review my dog's medical history. I need to consider any past medical conditions or surgeries my dog has undergone. Certain health issues, such as bladder infections, urinary tract abnormalities, or previous surgeries affecting the urinary system, could predispose my dog to wetting the bed. Additionally, if my dog is on any medications, I should inquire about potential side effects that may cause increased urination or incontinence. Consult with a veterinarian. If I'm unable to determine the cause of the wet bed or if my dog is exhibiting concerning symptoms, I should schedule an appointment with my veterinarian. They can conduct a thorough physical examination, perform diagnostic tests, such as urine analysis or imaging studies, and discuss possible treatment options based on their findings. Additionally, my vet can guide preventive measures and lifestyle adjustments to help manage or alleviate the issue. By carefully considering these factors and seeking professional guidance when needed, I can identify the reasons behind my dog's wet bed and take appropriate steps to address them effectively. How to handle situations that cause a wet bed for your dog. Addressing medical conditions. If my dog's bed is consistently wet, it's crucial to schedule a veterinary appointment promptly. A thorough examination can identify any underlying medical conditions contributing to the issue, such as urinary tract infections, bladder abnormalities, or urinary incontinence. Depending on the diagnosis, treatment options may include medications to manage infections or incontinence, dietary changes, or surgical interventions to correct structural issues. Giving regular bathroom breaks. Establishing a consistent bathroom schedule is essential for preventing accidents indoors. I will take my dog outside frequently, especially after meals, playtime, and periods of rest. Positive reinforcement techniques can encourage appropriate elimination behavior outdoors. Watching water intake. Monitoring my dog's water consumption is essential, as excessive drinking can signal potential health concerns such as kidney disease or diabetes. I'll observe any changes in drinking habits and report them to the vet for further evaluation. Adjusting diet if needed. Dietary factors can significantly impact urinary health. If my dog experiences recurrent urinary issues, the vet may recommend a specialized diet formulated to support urinary tract health, such as a prescription diet designed to prevent crystal formation or bladder stones. Managing stress and anxiety. Stress and anxiety can exacerbate urinary problems in dogs. I'll create a calm and comforting environment for my dog, minimizing triggers that may induce anxiety. Implementing enrichment activities, providing safe spaces, and using calming aids like pheromone diffusers can help alleviate stress. Keeping the bedding clean. Maintaining a clean sleeping area is essential for my dog's comfort and hygiene. I'll use washable, waterproof mattress covers to protect the bedding from accidents, washing them regularly with pet-safe detergent. Additionally, frequent laundering of bedding helps eliminate odors and bacteria, promoting a fresh sleeping environment. Providing exercise and fun. Regular physical activity and mental stimulation are vital for my dog's overall well-being. I'll engage my dog in daily walks, interactive play sessions, and puzzle toys to keep them mentally and physically stimulated. Adequate exercise can reduce stress levels and contribute to bladder health. Using training techniques. If my dog exhibits behavioral issues contributing to wetting the bed, I'll enlist the help of a certified dog trainer or behaviorist. Positive reinforcement training can address inappropriate elimination behaviors, reinforce proper toileting habits, and strengthen the bond between my dog and me. Considering medicines or supplements. In consultation with the vet, I'll explore the option of medications or supplements to manage urinary incontinence or alleviate urinary discomfort. Prescription medications may help control bladder function, while supplements like cranberry extract can support urinary tract health. Watching progress and making changes. Monitoring my dog's response to interventions is essential for refining our approach. I'll keep a record of any changes in behavior, urinary habits, or symptoms, adjusting our management plan accordingly. Regular follow-up appointments with the vet allow for ongoing assessment and modification of treatment strategies. By implementing these detailed steps and collaborating closely with the vet, I can effectively address the factors contributing to my dog's wet bed, promoting their health, comfort, and overall quality of life.